but for now my aesthetic is tired college student. Hey friends, it's Carly and I'm here to answer your big question, what is occupational therapy? I'm going to give you a quick definition, talk about it, give some examples so you can better understand what it is. If you're new here, hi, I'm Carly. I'm so glad you're here. I'm an Occupational Therapy Assistant student that makes videos about occupational therapy assisting and occupational therapy in general. So if you want to join me and learn with me on my journey to get certified, then click the subscribe button and the notification bell because I don't want you to miss out on the fun. Hi, Rosie. Now I have rosy hair on me. Alright, so first of all, I'm just going to tell you the basic definition. Cat hair. This is the basic definition by Merriam-Webster. OT is defined as therapy based on engagement in meaningful activities of daily life, such as self-care skills, education, work, or social interaction, especially to enable or encourage participation in such activities despite impairments or limitations in physical or mental functioning. So simply, that just means you're helping someone, no matter who it is, no matter what age, no matter what is going on, you're helping them live their life to the fullest, whatever that means for them. Mary Reilly once said this quote, "Man, through the use of his hands, as they are energized by mind and will, can influence the state of his own health." Mary Reilly was an occupational therapist that graduated in 1940 with her degree, and she changed occupational therapy for the better. And she really founded the philosophy of just how the will of yourself and wanting a better life means so much when you need to recover or you need to rehabilitate. So occupational therapy really started to gain way in World War I, and it was coined reconstruction aid because OT is very holistic. It pulls from medical, from mental, from diet, just everything. The whole person is considered in treatment. Let's just break it down. So, occupational therapy, occupation. An occupation is commonly thought of as a job, and it is, but it goes farther than that. It's not just like your 9-to-5 job, it's your job in every single aspect of your life. So, you might have the occupation of a mother or a father, or the occupation of a daughter, a sister, a cousin, a friend, a traveler, a blogger, a chef, an employee. Whatever your occupation is, it is important that you are able to do that to the fullest of your ability. For example, my occupation is student, along with daughter, friend, girlfriend, granddaughter, cousin, soda officer. I have all of these different hats that I carry, and they are my occupations. Then within those occupations, I have activities of daily living and instrumental activities of daily living that are very important for me to be able to carry out. An activity of daily living encompasses all of self-care, so bathing, toileting, feeding, things like that. And then a IADL is more of communication, homemaking, managing finances, managing medicine, communication, social life, things like that. That is an instrumental activity of daily living. Now, if something were to happen to me, such as I got in a bad car accident or I became really depressed, those things in my life, I wouldn't be able to do them to the fullest of my ability, and I could possibly need occupational therapy. So I saw this on Instagram last night and I thought it was really cool and I wanted to share it with y'all. It's from lovely_OT. She says, "The whole point of occupational therapy is to get clients to engage/participate in occupations, which are our daily activities and routines, if they are unable to do so due to physical, emotional, mental, cognitive, or developmental disabilities. Your job is then to find out what the underlying problem is and find solutions together, which is key, to rectify it so clients can do, engage / participate as they need to. Something that is so cool about occupational therapy is that it is so holistic, and it is really important for the client, the resident, the patient, whoever you're working with, for them to have a say in their treatment. So some examples of occupational therapy could be a child with autism. They may need some OT for behavioral outbursts, and they've got to work through that, and occupational therapy can help with that. It could also be an adult who got injured on the job and now they need to rehab to be able to get back to their job or learn to adapt, and they could get adaptive equipment and learn to use those in their daily life so that they can live their life to the fullest of their abilities. It could also be someone who is older, who might be in a SNF, which is a skilled nursing facility, and their activities of daily living are going to look very different from an adult living at home. Their main activities may be getting up and sitting in their wheelchair and eating at their tray table, going to the bathroom by themselves or with supervision. Whatever that might look like for them, you are there to help them to live their life in their state that they are in to their fullest and make them as comfortable and as independent as possible. OT could also help someone that has become very depressed or anxious and it's affecting their daily life. And while we are not counselors, we are holistic and we are able to look at the full person and treat them as their full person. I hope this helped clarify occupational therapy. It is such an amazing profession and it is so broad and so vast that it's really hard to wrap your head around. I hope this can just be a starting point for you, and I hope your journey just goes much farther than this and you fall in love with occupational therapy like I have. If you stayed till this point in the video, comment down below, I love OT, because what is there not to love about OT? Alright, remember you are loved, your feelings are valid, and you deserve to hold space in this world. Much love, my friend. Bye.